So as I mentioned earlier, when we were going over that super fun PowerPoint presentation, hopefully you're still awake to watch this video, is we're going over some lower back issues that may be stemming from something going on anteriorly. So we're going to address the psoas, and I'm going to show you some stretches that you could do. I'm going to use the true stretch cage right here. This is not something that you have to do. I'm just using this as an example, but by all means you can elevate your foot on a couch, a bench, it doesn't matter. We just want our back foot elevated up here, like this. I'm going to step in so. I'm going to put a cushion down for my knee just for comfort. And we just want to picture that we're moving the pelvis forward and rotating it upwards. So I'm going to lift my arm just to get a little bit more of that hyperextension right here. So I'm going to cause a little bit more extension, causing that pelvis to kind of get a little bit more of a stretch in there for that psoas. So when I hyperextend here, boom, I'm going to get that psoas right there. So I'm only concentrating on just rotating the pelvis upward and just pushing the pelvis forward. So we don't really need to push the knee forward. That's going to be exaggerated. In fact, with that, you're going to get a little bit more of the rec fem. So right here, I'm going to get the rec fem and the psoas major. So boom. We're going to go up like that, and we want to be dynamic with it. So I'm going to hold each one for about 3 to 8 seconds, and you can do 3 per leg, 5 per leg, whatever you're planning to do. And then after that, I'm going to show you some functional movements that I want you to do for a warm-up also. So when you're stepping into, after we stretch it, we're going to get all loosey-goosey. Then we want to get that functional muscle tension that we talked about earlier in the PowerPoint. So I'm going to step the foot forward here, and I'm just going to raise my arms, but I'm going to keep my back heel planted on the floor back here. So now we're just concentrating on that anterior chain. Once again, I'm going to raise my arms, pushing just the pelvis forward, no reason to lean forward into it. Pushing the pelvis forward, raising the arms, stepping into the next leg. Coming forward, raising the arms, coming into the next leg. Now you can do this with a self-FMR technique, and I actually have a video on Instagram that I posted not too long ago where I show that I have like a band wrapped around my legs. So what I'm doing there is I'm speeding up the pelvis and I'm slowing down kind of from the tibial-femoral. So we're slowing down here and we're speeding up here. Unnecessary, not super necessary, but if you're doing this as a warm-up for like squats, deadlifts, any kind of leg exercise, or just trying to loosen up the back when you get home, you don't have to have the band. Just this right here is enough. So we're going to go through all 3 planes of motion. So that would be the sagittal plane. Then we're going to do the frontal plane. So you just want to kind of give yourself a side lateral lunge like this. Once again, raising the arms, pushing the pelvis forward, doing your best at keeping the heel planted on the floor. Rotate to the, or alternate to the other side. Bringing it up, push the pelvis forward. Bringing it up, pushing the pelvis forward. Now when we go into transverse plane, you're just going to rotate backwards. So I'm going to rotate here. I'm concentrating on rotating, externally rotating my left hip. When I rotate right, getting relative rotation, and now we're just going to push it forward, and then going to the other side. Rotate, legs stay straight, knees stay extended. This knee is going to be flexed, pelvis forward, raising the arms, going right to the other side. So this is one method out of infinite methods. There's no the way, there's just a way. I would definitely recommend these when you're just starting out because it's super basic. And there's no reason to get super complicated with it. So keep it as simple as possible, and then if it gets worse or if it's not helping too much, or it could be something else, then you would want to broaden your horizons. You want to add to it, something like that. But like I said before, you're going to get it loosey-goosey, adding muscle tension through all 3 planes of motion, and then you can go into your activity. This has been Vince Barbaro, and thank you so much for watching this.